Okay.
So from what Blessing is saying, she discovered when the first time she went to the doctor, as she said, it was a lump and they told her it was non-cancerous, right?
Yes, yes.
She goes back there 6, 7, 8 months later,
yeah.
and that's how she discovered that it was cancer stage 4. So as a doctor, what are the procedures what would you like to ask her concerning how she got from that level to the stage 4 level?
First of all, I'm very interested to know what type of doctor you saw, because there's a lot of disparity that I don't expect in medical personnel.
Okay, what are disparities?
So first of all, when a patient comes to me and complains of a lump, I will not do a biopsy first. I will first do an imaging. So I'll tell you to either do an ultrasound scan if you're less than 40, you're 35, 40. Then if you're above 40, you can do a mammogram before we get to the biopsy. And if you then do a biopsy, depending on what we're suspecting based on your history, you either do a fine needle aspiration cytology or a core biopsy, right? And after that, even if, because what you're describing kind of sort of sounds like you did a fine needle aspiration cytology, right? Even at that, no doctor on the surface of this earth that is qualified would allow a patient to move around with a lump in their breast for 6 months, because you don't know. Even if you do a fine needle aspiration cytology, they can be false negative. There's a very high chance of it being false. So you can never tell unless you remove the lump and you do a proper biopsy of the lump.
So what are the
inconsistencies
in her story?
So I find it very interesting that so I'm interested to know the type of doctor you saw. What type of doctor?
I think it's an oncologist.
Okay, so now, fantastic. So I work in a teaching hospital. We don't send patients to an oncologist unless you have a biopsy, core biopsy result.
Well, she hadn't had
because usually you start with a general surgeon. General surgeon will establish the fact that it is cancerous, and oncologist is not the first person. Based on the fact that you even said, the person said it is not cancerous, no doctor will send you. That's why I'm interested to know the doctor. No doctor will send you to an oncologist with a non-malignant result.
Like I said, you go into the hospital, I noticed a lump on my boobs.
Was it Lagos or Enugu? Because I
was in Enugu.
Okay.
So I went into the hospital, complained.
Was it a teaching hospital?
No, it wasn't a teaching hospital. It was a private hospital.
Okay, and it has an oncologist. That private hospital has an oncologist.
Let me explain.
Okay.
So walking into the hospital, you go to a normal doctor. I don't even know what they're called, but you went to a doctor, he examined, he found the lumps.
Okay.
That was when he said, let's do a biopsy. I don't know what a biopsy is.
Without an imaging?
No.
That's very strange.
No imaging, because...
Is that possible?
It's not possible. It's not possible. Because biopsy is very invasive. Nobody will grab your breast and just do a biopsy without an imaging.
There was no imaging.
Was it the left breast or the right breast?
The left breast.
Okay.
Okay, so they didn't do an imaging, they just said go for a biopsy. It was when I went for the biopsy, it took about
Was it painful?
What was the biopsy process like?
Yes, what was the process like?
Explain it to us.
I think they gave me the little, I don't know if it's anesthesia to like numb the pain a little bit. Then an incision close to the nipple.
And what came out?
That's not the procedure. We don't do an incision.
I don't know what, but something went into my...
Okay, so
my results are
Are you
here.
saying that's false? It's not possible to...
No, yeah, it's not. It's not sounding like a fine needle. It's not sounding like a core biopsy. It's not sounding like a fine needle. We use a needle. It's a needle.
This one is like how do I put it? Why would you call it a machine? I don't know the right terms.
Oh, listen, you're
people
mixing things up. We don't use machine for biopsy as well.
That's
an invasive procedure. We use a needle.
Something went into my boobs. They brought out some. I think they said
what part of your boobs was it?
Exactly.
Your
What type of your?
Was it?
The lump was found under my boobs. It moves sometimes. Sometimes it looks as if it beeps. So I think around that place, I think they said they bring out. I don't know if this particle of the lumps or thereabout. That's what they say. Yeah, they took for the biopsy.
With a machine.
Sorry, is that
maybe a pin?
No, it's
medically feasible.
No, it's a long needle.
Maybe that's what
has a trigger.
Okay, what's
it's
the
like
size
a
of
mini
the
gun.
Wait, what's the size of the needle they used for you? If you're going to estimate it,
how do I?
Was it like 2 inches long, 1 inch long? How was the needle?
I was lying down, so not like you're seeing exactly what is happening. And I'm not in the medical term, so I
No,
don't want to say the
listen,
things
I'm sorry
that...
to say this, right?
Go ahead.
I saw that you studied economics, right? Okay, fantastic. I interesting enough, I dropped econs for further maths because economics was very, very detailed and very, very... So as someone that studied econs, I would expect you that if you have a life-threatening diagnosis, you should know it in and out, because when I see patients with chronic medical conditions, they know their condition in and out. Like sometimes they even know new researches that I have not even heard of because they are trying to survive. I find it very strange that you are mixing radiologists, oncologists. I feel like it's something you should know.
No, it's not something I should know because cancer is not something I am aware about. I've said it
No,
over
but
and
you've
over
been
again.
given this. It's been 2 weeks since you came out to talk about this, and you mentioned stage 4. That was the first video I ever saw from you.
Yes, that was
stage
the...
4. How did they come about that stage 4?
I'm not supposed to know. So maybe at this
It
point
is
we are
your
going to
life.
That's what I'm trying to say. At this point, we're going to be asking the medical doctor. So when this whole shenanigans came out on social media, everybody just said, let's get a second and a third
No, but
option.
Okay, so
How
let me
did you
say
know it was
something.
stage 4?
Exactly. How did you know it
How
was
did
stage?
you
Because
get
he
to the
seems
stage 4
quite
analysis?
confident with that stage 4.
Because that was what I was told. I'm not a medical
How
doctor.
is it possible to say you have stage 4?
Maybe
if
they
Was
they
it
haven't
same
done-
that it was that same Enugu doctor?
Yes.
Is it on in your report?
She's willing-
Exactly.
She's
Yeah.
willing to show the doctor.
I will share.
Yes,
I will share.
I don't.
Okay,
I'm
can you show
interested
her?
to
I would
see.
share.
So this is your stage 4 report. Is it the doctor that told you that it was stage 4?
Yes, the doctor
By the time
said
you went
stage
there the
4.
second time?
Yes.
But what?
Just
can I-
based on seeing you was when he calculated that it was stage 4?
I do not know them. I don't want to say
What
things
do you
I'm not-
understand? Because if someone tells me something, right, I would go and read up on it, right? So what did you understand by stage 4? Because I'm assuming that you don't want to die, right? So if someone tells you stage 4, it sounds advanced, right? Or
Yeah.
you don't know that.
Yeah, that's the reason why I broke out on social media.
Social media,
Yeah,
to
but how did it
answer
get
the
to
question
stage
for
4?
you, what was social media? What was your goal on social media?
Now, as a medical practitioner, when they tell you have cancer, it's already traumatic alone.
Okay.
I didn't even have the guts to go and start reading. In fact, the major reason I came on social media was I wanted to see people who have experienced the same thing.
Yeah, but the big question is how did you conclude that it was stage 4?
Stage 4,
Did
exactly.
the doctor just look at you and say, oh, this is
Sorry,
stage 4?
Roots, she's willing to share the report.
That
is
is what
Why
I
not
was
allow
told.
the doctor look at it?
That was
Okay,
what
the
I
doctor
was
can
told.
look at it.
Yes, I'm very interested.
Can
look at it.
she look at it?
That's what I was
And
told.
let me ask you, as a lawyer, if someone publicly claims... sorry?
It's interesting that you're bringing the same results to me because Dr. Odigwe, the pathologist that signed this report, because of course we have a...
Is it the same report as the one that we saw?
Yes, the
last time?
pathologist that signed this result lives in Asaba. And I'm a doctor, of course. I can trace any doctor in Nigeria. And I called him on Tuesday.
Sorry,
and he
before you
knows
talk,
nothing
is that the
about-
same report
Yes,
that
it's
you
the
saw
same
last
result.
week?
It's the same result that is going
Okay,
around
that he said
social
she
media.
didn't post, but it's around.
And this particular pathologist said he knows nothing about this. And he is based in Asaba, not
The
Enugu.
pathologist of the report.
Yes,
there.
of this report is based in Asaba. I know that for an absolute fact.
So he told you
So that's the
after.
first one.
Yes, because yes.
He told you that he has nothing to do with it.
Yes, and he stays in Asaba. The address here is Enugu. He hasn't been to Enugu in recent times. He lives in Asaba,
So,
Delta
President, how do you
State.
respond to that?
This
Let's go
pathologist
ahead and,
stays
like
in
I
Because
said,
they're saying that the
Asaba.
pathologist that you put in that report, which you claim
That
is your
signed
real
this
report.
report stays in Asaba. That I know for an absolute fact.
Please, I want
on
to ask
Tuesday.
again.
Go ahead.
Is this report the same report that we saw last week?
Yes, it is. It's
So
the
this
same
same
one.
report that we saw last week, that blessing you claim you didn't post on your Instagram page and on your social media page, is the same report that guy,
Yes,
the guy that
exactly.
we saw on the video, which unfortunately they have not been able to show us, is the same report he printed. So
Absolutely.
this is your real report.
So that's the
What
first one.
happened to the brother of the girl who claims that this report was forged?
I don't know who the person is.
So it's not a fake report.
No, it's not a fake
But the brother of the girl that you just saw just now says this report is his sister's report.
It's not.
It's
And
not.
this doctor stays in Asaba.
So are you saying, and number one, they're saying it's you don't know that man. Number two, you're also saying you didn't post this report
I didn't.
to the guy who just spoke on social media.
Absolutely.
But for some coincidence or some funny reason, the reports tally. The report the guy posted and the
Perfectly.
report here, they are totally the same, word for word.
You
are
know,
now
this
saying
doesn't tell us that it's stage 4.
but
by
you
the
are
way.
now even saying the oncologist whose name is
No,
there.
the pathologist.
The pathologist whose name is there said he doesn't
Lives in
know her.
Asaba and he doesn't know anything about this.
So, Blessing, what do you want to say about that?
Diagnosed cancer?
No, so the way it works is that, you know, in medicine there are different fields, right? So the process for a person that comes with a breast lump, you don't know what it is. So the first stage is to go for imaging. You come back from imaging. Right now, the modality is to do a biopsy, fine needle aspiration biopsy. Even if it comes out benign, you have to take out the lump. You
So in other
cannot
words,
go
she should
because you
have- it
cannot
should
be
have been
very
taken
sure.
out from the
No,
womb,
yes, because
regardless
that
of
is-
whether she wanted it or not.
That
it
is the
is not your
carelessness.
choice unless you discharge yourself against or you do it against medical advice. It's not likely. You cannot come to me and you said you're not ready unless you're not medically fit. Maybe you're very sick, you're pregnant, you're not medically fit. But it's a if they're thinking it's benign, it's a simple surgery. It's not invasive.
Okay.
It's a day surgery. Some people go home that same day. They do go home that same day.
No, but you see, right now it is they are conflicting. There's already inconsistency because on one hand you are showing her the same report that was displayed last week. Blessing, I'm talking to you.
Yeah.
You are showing her the same report that was displayed last week. Meanwhile, you're saying you're not the one that sent it to that guy.
I have not seen the result that
Yeah,
you
but,
displayed there.
but
So-
there was a
She said she have
screenshot.
another-
Yes, so like I
So
said,
you have another report to show
everybody
us.
says, okay, go for an open auction. So I went to Luke's cancer center, to do the same stuff. So they gave me a couple of.
What did they give you?
I did my whole stuff. So they asked me to
What
do
are the
What are the
couple
stuff?
of,
Because you need to be more.
You have to be very, very specific now, please.
I'm not a medical doctor.
But you can't say that.
You have an ailment that is
Yeah, exactly. It's life threatening. You can't say that.
So
Yes.
so these are the tests I'm running. So maybe when the
Running,
test,
not that you have run.
no, they just asked me to. So
So
I
by
think they-
stage 4,
they
shouldn't
will
you have
come out.
already run those tests?
They didn't ask me to run this, so it is not my fault.
I know, but I'm curious as to how you came to the stage 4 conclusion
That was what I was told.
without any tests being done.
I mean, this doesn't prove anything, unfortunately, because
What's that report that you
it
have?
just says it states a series of tests that she should carry out.
there? If what?
It's just a series of tests, chest X-ray, that we do to confirm metastasis, right? But this is not solid enough because I can enter LASUF right now and write anybody's name and write this series of tests, right?
The result is not out.
This is not a result, exactly. So results will be more,
Recommendation.
exactly.
So let the result come out. I can now come back and show it to you people.
Okay, first and
So
foremost,
as
I
a
want to
second
ask,
option.
because right now, the area is still very grey, and I really think that we need to dig deeper. Because cancer is not a joke by
It's
any
not,
standard. So I want to
actually.
ask you,